What's good, you with the veterans, military, back again with another banger. No, Washington, D.C. did not call me, but I got some information for y'all pertaining to the VA proposed updates to disability schedule rating, respiratory. Today we're going to be diving into the chronic sinusitis or Sinusitis and allergic rhinitis. Let's get into it. So first of all, we got this motherfucking powerful slide right here. And it's pretty much VA is proposing they want to change of the current chronic sinusitis ratings, designations, and the name to rhinosinusitis. Okay, and the same with allergic rhinitis, but we'll get to that in a little bit. So the VA wants to change the current diagnostic codes for 6510, 6511, 6512, 6513, and 14. And they want to change the naming convention from chronic sinusitis to, they want to replace chronic with rhinosinusitis, or just the name sinusitis, as well as change the rating criteria as well per level. So you got 50, 30, 10, and a 0%. We're going to dive into that on later slides, but you know, this is just general information right here. This is VA come like, hey, we don't like how sinusitis sounds because veterans are just going out getting a diagnosis of sinusitis, whatever. We've seen a couple, not a lot, just a couple of medical terms, medical research update within the field. So we want to make sure that we're updating our information as well. So to combat veterans trying to get, come in with a diagnosis, okay, cool. Yes, those veterans who are currently service connected for chronic sinusitis or allergic rhinitis will still maintain their current disability rating as well as the designation, but they will be changing the name. And if that veteran ever did in the future want to get an increase, if this proposal actually goes through, then those veterans who were grandfathered in under the old rating criteria will now be cross-checked against this new rating criteria. Moving on, baby, moving on. Okay, continue. They want to modernize the process. Cool, I got it. They don't want that name chronic anymore because they figured out that there is a difference between chronic, acute, and serious issues. Well, they're trying to change it to rhinosinusitis now. Maybe y'all can look up these case studies. And we're going into, acute rhinosinusitis. ARS is defined up to 4 weeks. And it's going to be the 10% criteria in the future, but I will, just hint towards that right now. So we're looking at that 4-week time period of issues pertaining to acute rhinosinusitis, drainage of the anterior, posterior, or both nasal obstructions, nasal canals, full face, all these signs and symptoms that they're going to be looking for in order to get that 10% criteria. Moving on, talks a little bit more into the acute. Okay, cool. It's cute. Okay, now get towards the end of this. Let's say, okay, if rhinosinusitis symptoms last for at least 4 weeks, but less than 12 weeks, to the 30% criteria. This is the final form of the Broncos versus the Patriots, baby. I'm talking about. We going to Super Bowl, baby. Keynote, neither one of these teams is one of my teams. I'm 49ers all day, baby. Y'all know what time it is. Hold on. So, finally, chronic rhinosinusitis or CRS is defined as symptoms lasting more than 12 weeks with the following: drainage, anterior, posterior, nasal obstruction, facial pain, pressure, fullness, decrease in sense of smell, and a combination of inflammation as documented by at least one of the following: purulent mucus not clear in the middle of the meatus or ethmoid region, polyps, obviously, they're trying to bring in a little bit from the rhinitis in the nasal cavity, and in the middle meatus, and radiographic imaging showing inflammation of paranasal sinuses. So what does this mean? This pretty much means that veterans, whenever you're, just to keep it safe, I know a lot of veterans don't do it because they say, oh, it's too much time. But whenever you're experiencing a sinus episode, chronic sinusitis, rhinosinusitis. Ensure that you're going into your doctor, you're complaining about it, and you're getting images done. Imagery is going to maintain you at your current VA disability rating, as well as boost you up to those higher levels. So if you're like 10% and you know you deserve a 30 or 50%, if you're conducting MRI, nasal endoscopy, CAT scan of these areas, whenever you're having sinusitis issues or rhinitis issues, it's going to plus up your medical evidence, maintain you, as well as increase you to that next tier of VA disability. So moving on to this last caveat, VA compensates disability. So this is the main thing they're thinking about. Okay, compensation, baby, compensation. That impaired hearing capacity, not temporary conditions that generally do not impact the hearing capacity. So the current criteria and definitions underneath chronic sinusitis and allergic rhinitis mainly lean towards temporary issues. So now they want to adjust it due to that medical study that they had from earlier, and to conform with the current medical literature understanding that, hey, to assist the public in rating activity and better understanding what disabilities are compensated. So they could possibly, it's not in here, but they're trying to talk about, okay, which levels of sinusitis can we compensate? So just looking at this, your level of, the severity of your sinusitis, as well as your chronic, or your rhinitis, it needs to be concurrent. It needs to be always occurring. Not once in a while, not once a year, not whenever you're going in for a CMP exam. You know what I'm talking about? No, it needs to be something that's permanent so that you can get compensated on. So that's what I'm taking away from this. VA proposes to include a note identifying which conditions are eligible for compensation, and another note specifying which conditions are explicitly excluded from compensation. So now they're going deep. They want to go a little bit deeper and have a little, increased say-so of which veterans they can compensate due to their medical evidence, the severity, and if it's acute or if it's a temporary disability. So yeah, you can have a diagnosis of sinusitis or rhinitis, fucking sleep apnea as well. However, if you're not getting routine episodes frequently every year, the VA will say, okay, we'll service connect you with it. However, it's not going to be at a compensatable level. That's what I'm taking away from that sentence in that paragraph. Hey, that's my own analysis. I've been reading into this. Let me know how y'all think about it in the comments. Now, the present rating criteria, and it goes into that. Chronic sinusitis predominantly is rated on frequency of incapacitating episodes, which includes prolonged antibiotic treatment, as well as a need for bed rest and treatment by the physician. Current standards of medical care, however, no longer describe incapacitating episodes or bed rest as a treatment. Like, hey, no, motherfuckers, y'all need to get into the doctor. We want to see you physically in the ER, paying some dollars. Motherfucker, you got everything except for the goat up in the goddamn. They want it all. They want none of this bed rest as treatment anymore, because it's like, okay, anyone could just fudge like, yeah, it took me fucking 12 weeks out. Okay, well, how do we know this? So no, they want you in a hospital being treated on prescription drugs or any type of things. You know what I'm talking about. VA proposes to retain those elements of existing criteria, just some. They're picking and choosing what they want to keep, namely frequency and duration of antibiotic treatment, but they scratching that bed rest. It's like, nah, fuck the bed rest. We want to see y'all inside of it. And still related to the current medical practice and episodes, blah, 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 blah. VA also proposed to obviously going to maintain a 50%. However, they want to add that strict caveat, require unresponsiveness to surgery. So they're looking at surgery now for your chronic sinusitis. Now, no like, I declined, I still want 50%. No, you're not going to get 50% unless you've undergone surgery for your rhinosinusitis and or chronic sinusitis, and it's still you're still having the same issue. It may have decreased a little bit, but you're still having the same issue on a routine basis X amount of times a year. moving on from there. More information on that rating criteria I was talking about. In light of the above, VA proposed general rating formula for chronic rhinosinusitis. You know, if it goes through, this will be replacing the current chronic sinusitis ratings, as well as recurrent acute. They're going to be retaining the same levels, 0, 10, 30, and 50. I already went through it, but you know, the beginning with 50%. With the 12-week treatment with antibiotics and surgery with endoscopy. So now they're recommending that they're putting that endoscopy in there because a lot of veterans have been fighting for that 50% without no surgery and no endoscopy. So of course they're going to be pushing for that and that new proposed rating criteria. Going on to the 30% will be granted with 12 weeks, 4 to 12 weeks for this period with antibiotics, not going past 12 weeks. And that 10% period is going to be that 4-week time period undergoing what is it? Let me see. No, I can't see my eyeballs. Which requires antibiotic treatment for at least 4 weeks, but less than 12 weeks. Okay, there you go, right there. Time period during the 12-month period. Finally, 0%. You know, hey, 0%, 0%. As long as you got diagnosis, you have some issues, you get service connected, the VA will take care of you in that aspect. So let's move on to the allergic rhinitis, baby. And there's three different versions of allergic rhinitis. It's allergic rhinitis, bacterial rhinitis, and motherfucking galactus level rhinitis, which that galactus level gives you 100% if you are one of the rare few people have it. But that's on the next slide. Let's get into the first two. Finish up this video. So we got the current diagnosis of allergic rhinitis, and they will be renaming that to, so they want to add this, like I was saying, they want to add this, rhinitis to that rhinosinusitis, because a lot of veterans either have one or the other. It's all nasal issues, so the VA is like, fuck it, we're not trying to have veterans running around with a 30% for rhinitis and a 30% for sinusitis. No, they want to scratch it and add it to that rhinosinusitis. Look, first, VA proposes to modify the criteria for a 10% rating requiring continuous therapy, almost always self-administered for control systems. Okay, that's cool. VA also proposes the 30% criteria for the presence of polyps, preserving the prior rating criteria. Okay, VA will add a note. The Rex, blah blah blah. Using okay. So, not too much over here. It just seems like the VA just wants to modify some things. Obviously, change the naming convention to be similar to rhinosinusitis. They want to redesignate it. VA wants to repurpose allergic rhinitis under rhinosinusitis. So it'll still be crossed under rhinosinusitis. However, it'll just be named specifically rhinosinusitis, TAC, rhinitis. Whether you're at the allergic level, the bacteria level, or the granulo. Anyways, I ain't a doctor. I ain't gonna try to fucking pronounce this shit. Moving on from there, and then you got the 100% level. So if you got that 100% level of granulomatous rhinitis, provides 100% for the